Good afternoon, everyone. Thanks for joining us on the media briefing for this Wednesday. We have a late add into the briefing, and we're going to, before we go to Military and Veterans Affairs, we've got Karen Smith, our PIO from the Health Department, who has some quick information she wants to share about our testing sites. Karen, go ahead.
Good afternoon, everyone. So there's some new, I can actually, if you want to see me, there are some about our free walk-in testing site. As of Friday, they will change to self-observed self-swab. So instead of individuals having a nurse stick the swab up their nose, they will do it themselves, being observed by healthcare professionals. This is to increase the amount of tests we can do in one day at those particular sites. Just important to note that Soledad is remaining the same because it's easier just to do regular ones in a drive-through. So there's that. This is not a rapid test. It will still take 2 to 3 days to get your results back from the test. It is a PCR test, not an antigen test. So this will still continue to count in our numbers, moving from the purple tier to the red tier. And it was not a decision, and just an FYI, it was not a decision that Monterey County made. It was a decision that LHI, the state testing task force, did. So that will start on Monday. And if people need help with self-swabs, there'll be somebody to help them with that. But that's a change that's coming to Castroville, Seaside, and Salinas. And that's my update.
Thank you. And if you were showing something on your screen, it didn't show up. If there's a slide or something I can send out afterwards, go ahead and send it.
Okay, will do.
Okay, thank you very much. Thanks for dropping in, Karen. And now we'll start with our scheduled lineup. We're joined by Jack Murphy and Jason Cameron from the Military and Veterans Affairs Office for Monterey County. And they're going to tell us a little bit more about vaccine opportunities for veterans. We have seen a lot of veterans getting their shots recently, and hopefully you can tell us there's more of that to come. Good afternoon, gentlemen.
Thank you so much. I'll go ahead and go first here. This is Jason Cameron, Military and Veterans Affairs Officer for the county. And, absolutely, our efforts have been extremely successful and resulted in 1,000 Moderna vaccines already administered at the clinic here in Marina, with another 400 set for this Friday, March 5th. All appointment slots have been filled for this March 5th iteration of vaccine. And we are working diligently to get more allocated through the Congressman's office and directly through the VA healthcare system. Currently, veterans must be enrolled with the VA for healthcare. Eligibility for vaccination through the VA Palo Alto healthcare system is currently at high-risk veterans, beginning with homeless veterans, dialysis, transplant, chemotherapy patients, and veterans over the age of 55 years old. So they've reduced the age restriction down to 55-year-old and above for the VA vaccination, wherever you get it through the VA, greater VA Palo Alto healthcare system, which the clinic here in Marina is part of. The VA is offering the COVID-19 vaccine to veterans, again, at the greatest risk of infection and severe illness based on the CDC guidelines, and will continue to work their way through the established priority groups. Also, it's important to note that caregivers who are enrolled in the VA's program of comprehensive assistance for family caregivers are also eligible to receive the vaccine when the veteran they care for gets theirs. So if there's any question on that, the caregiver or the veterans should contact our office at 831-647-7613. Now, in addition to the lowered age restriction, the VA is also offering the vaccine to veterans who identify as essential workers, as defined by the CDC. Veterans who are essential workers should contact their patient alignment care team, patient care services, essentially call like they're going to make an appointment with their healthcare provider through the VA and let them know that they are an essential worker and go that route in order to get an appointment for the VA vaccine. Veterans must be enrolled in VA Palo Alto healthcare system, and they should call if they're not an essential worker, if they're just the 55 and up group or caregiver, they should contact the 650-496-2535 to get registered. Now, veterans who are not enrolled or do not currently receive care at the VA, they can contact our office either online at mvao.org or call us at 831-647-7613 to explore options and eligibility for VA healthcare in order to be eligible for vaccines now and moving forward. One last thing. Our office was made aware of HR 1276. This is a new congressional bill that was introduced that would open the door to veterans that are not enrolled in VA healthcare by allowing them to obtain the vaccine through the VA. We worked with the congressman's office, and as of this morning, I confirmed that he is fully supporting this bill now and has also co-sponsored it as of this morning, which should reflect on the congressional bill websites probably tomorrow when it all updates. So with that, I'll go ahead and pass it over to Jack to see if I miss anything or for him to quickly reiterate anything. Thank you.
Thank you, Jason, and for the team to get the word out. In addition to the over 1,400 vaccinations that the VA has been able to do on site at the Gorley Clinic here in Marina, there are ongoing vaccinations being done up through the VA Palo Alto facilities. The way to register for those is the same way as all the others, is contacting them 650-496-2535. And we shouldn't lose sight of the great work the Presidio and the active components are doing here. So far, we've had 3 shot clinics on the Presidio providing vaccinations to military retirees and their dependents who have TRICARE, which is the military retiree healthcare system. They've already distributed over 600 shots. So in total, the veteran community has received over 2,000 shots in less than 3 weeks. And it's notable to point out that those vaccinations are not included in the county allocation. So this is just essentially icing on the cake. If anyone needs information on how to get a hold of either the VA or the Presidio of Monterey treatment facilities, give us a call at 647-7613 or email, as Jason said, at mvao.org. Thank you.
Thank you both. It's really great to have this great news for the veterans in our community. And now we're going to move to another sector of vaccine that has been of great interest, which is the education and childcare sector vaccines. And we have Dr. Deneen Gus from our superintendent of Monterey County Schools, and she's going to give us an update on that because, boy, there is sure a lot of interest in this next sector getting vaccinated. Good afternoon, Dr. Gus.
Good afternoon, and thank you for the invitation to be here today. Yes, we are super excited. Today, March 3rd, is the very first day that educators and childcare workers are able to receive their vaccinations. And so we're just excited to report that we do have over 18,000 individuals in the TK to higher education sector and over 1,600 individuals in our childcare sector. And we now have clinics that are planned throughout the county. So we have several healthcare providers who are helping us out, and these clinics will occur all over the county. Educators can also receive their vaccine from their primary care provider or from their local pharmacy if the pharmacy is also administering vaccines. So we're super excited. We know it's going to take probably at a minimum the entire month of March, may take even longer, but we have a very good start.
Boy, great news all around. Thank you so much. And I know that there will likely be questions. If you could stay on the line after our other presenters, I sure appreciate it.
Happy to be.
Thank you. And then now we're going to move on. Before we go to Dr. Moreno, we're going to talk about our cannabis program. Our cannabis program is launching an equity survey, which is of great interest not only to people who are in the industry, but our community. And then there's a lot that the Cannabis Fund has done to help the county through the pandemic. And so I'm joined by Joanne Iwamoto, our Cannabis Program Manager, to start off with this information. Good afternoon, Joanne.
Thank you, Mia, and thank you for inviting me. So before I begin, I would like to just provide a very brief background on the Cannabis Program. The program was established in early 2018, and our role is to coordinate with key departments, state agencies, the public, and the commercial cannabis industry and address regulation, policy, taxation, enforcement, education, and the protection of the health, environment, and the safety of our communities. Currently, we have 113 commercial cannabis businesses, 6 being retail dispensaries. Our industry is primarily mixed light and indoor cultivation, which equates to approximately which equates to approximately 4.35 million square feet, or about 98 acres. In calendar year 2020, their gross sales marked at approximately 147.8 million. We also have an outdoor grow pilot program in District 5 in certain allowable zoning areas that is showing signs of interest to new cultivators. We have a coordinated enforcement task force focused on the unlicensed market. Last year, they eradicated approximately 33,000 unlicensed plants. The cannabis tax revenue collected for last fiscal year was approximately 16.8 million. And so I am pleased to share 2 items for today's briefing. The first is the Cannabis Program Equity Assessment. The program was awarded a cannabis equity grant from the state of California and entered into an agreement with Cal State Monterey Bay to conduct this assessment. It will be a series of 2 online surveys. The surveys were launched yesterday and will remain open for 4 weeks. The business survey was distributed via email to those involved or are currently working in the industry. And the community survey is available on the Cannabis Program webpage and the Monterey County Facebook page. The results of the survey will be presented to the Board of Supervisors Cannabis Committee in late spring, and again following, if approved, to the full board. And this survey will help to inform the program to establish a framework for an equity component of our program. The second item is the Cannabis Program Cannabis Tax Revenue. The program presented a report that summarized how cannabis tax revenue has been allocated to benefit Monterey County residents. The report reviewed allocations since fiscal year 2016-17. Findings were compared against the priorities identified by community focus groups that were held in early 2018. Those constituents who met with each district board supervisor were able to voice their opinions on how cannabis tax revenue should be used. Since fiscal year 2016-17, our Board of Supervisors have made annual budgetary decisions concerning this revenue and has allocated approximately $38.8 million to various efforts that benefit our residents. The most significant allocation is this current fiscal year that had to do with the fire disasters and the current pandemic. Thank you, ma'am.
Thank you, Joanne. And we're also pleased to have Charles McKee, our County Administrative Officer here, who's going to tell us a little bit more about these numbers and the decisions about allocating the cannabis funds for these emergencies. Hi, Charles.
And Maya, thank you very much. Can you see my screen?
I see it starting. There you go.
All right, there we go. Excellent. So I think A couple things here. One, the cannabis program is something that is a partnership between the county and those involved in the industry, and it's a partnership that does not exist in every county or every city, and it's something that the County of Monterey was one of the early adopters in California. Recognizing that there could be those people who have a desire and a need for cannabis, personal use or medical use, as well as we could see the benefit to helping different areas of our community. And it's not, it's something that we recognize as the county government as something that is really important to utilize in the best way the revenues that may come from cannabis, but also understanding that it's not something that the county had to do or every board of supervisors in the state would do, and so we look at it as that partnership. And I think, as Joanne commented, we've looked at utilizing the money in ways that can most benefit the community. And to spread it across the community in many different areas. So as you see on the screen here, there are categories we have here. As first one is this education category, and you can see, for example, like the Salinas Valley Promise is helping our community members attend college, which is a great use. Obviously, the library bus down there at the bottom, everybody loves seeing that library bus come around, and so they needed a new library bus, and this helped get the new library bus. Moving down, you could see, looking at this next category, some of the other areas that are helping out throughout the community. Obviously, the COVID-19 response is critical, and we want to be able to fund that. The advantages of right now of using these monies for COVID-19 are obviously the on the ground, boots on the ground kind of help that we're looking at doing for COVID-19, but it also is really a bridge funding that we're able to use this money now, and we're looking to get reimbursement from the federal government through FEMA, potentially through, we had it from the CARES Act, and then this new stimulus bill that's going through Congress right now will help return these monies back into the cannabis fund is the intent going forward. And you can see things like the United Way call center, which was something being set up to help residents access services in the county, understand where those services are, as well as helping them register for COVID-19 vaccines. So that these are important things that we think as the county leadership should be funded, and we're happy to have that collaboration with the industry to do that. Moving down, the economic self-sufficiency area, one of the big pieces here is this Monterey County Small Business Relief Program, $900,000. So those are grants to some of our local businesses who were impacted by COVID-19. It's not just unincorporated county, but also businesses within some of the cities. They got money out of this to help their businesses, because we know many of them have been impacted and are struggling, and so this will help them survive, we hope, and be thriving once the pandemic is better under control and we can reopen our economy more broadly. Emergency funding for the food bank was something that was done early on by the board in the pandemic, recognizing the needs of those in our community who traditionally relied on the food bank, as well as new people coming to the food bank for assistance during this time of COVID. Moving down on safety, I think a key one here was the sheriff's radios, something that we all want the sheriff's office to have radios that work throughout the county, and their current system was getting pretty old, and we helped use this money to fund some of those replacement radios that were critical. And then finally, moving down to the last category, some of the overall county services that people may not be aware of that were where we utilized these funds. Well destruction, both of these here, both the well destruction under Prop 1A grant and the Prop 1A implementation grant are helping. You could also put it into the health category, because what this program is helping destroy wells that could potentially go through and cause contamination into our aquifers. They're wells that are not being used anymore, but still exist mainly in the area of the Castroville Seawater Intrusion Project area, where we have recycled water going to the farms out in that area. And this helps destroy those wells, which helps keep our aquifer safe. And so we think it's an important program to help fund for our community. And it's just one of the many programs that cannabis has helped fund here in Monterey County. And we thank the industry. We also thank the people who are helping support the industry. And we understand that some of that can be controversial. But if we're going to have a cannabis program in Monterey County, we think it's important to utilize the money appropriately across our county. So thank you, May, and I'm available for questions at the end when you're ready.
Thank you very much, Charles. Joanne, oh, she's gone. Is there anything you wanted to add before we move on? Have we covered everything? Okay. Thank
Nothing
you.
to add. Yes, thank you.
Terrific. Thank you. Thank you both. And then we're going to go to our last presenter, Dr. Moreno. Always a pleasure to have him here with an update on a lot of things happening. This is a very big day for us because a lot of people are now eligible for vaccine, and I'm sure he'll be talking about that and other things. And I see you. There you go.
Yeah.
Thanks for joining us, Dr. Moreno.
Yeah, good afternoon. All right. So yeah, good morning, good afternoon. Ed Moreno, Health Officer for Monterey County and Director of Public Health. So my update today includes just a brief update on cases. We continue to have a declining case rate, meaning the number of confirmed cases in Monterey County on a daily basis and a weekly basis continues to decline. And the state yesterday released our adjusted case rate, which is 10. And there's one additional outcome as a result of that new reported case rate. And that is because the case rate is less than 14, which is the criteria that is being used by the state to permit counties to implement youth sport and adult recreational sport guidance. So the information is on the state webpage, and I really do encourage anyone who's any organization who is organizing youth sports and adult sports to check out the state webpage to identify which of the moderate contact sports and limited number of high contact sports that can be where kids and adults can now resume play. And certain circumstances and if they meet certain criteria and requirements can compete against other teams. So again, encourage people to go to the state website to review the guidance. So that's because we dropped below 14, but if we continue to avoid gatherings and stay home as much as possible and continue to wear the mask and wash our hands and keep our distance, we should be able to continue to reduce transmission of the virus, which can further reduce the case rate and further reduce our positivity rates, which will not just reduce hospitalizations and reduce deaths, but will also possibly move the county into the red tier over time. In terms of the blueprint itself, we've been notified by California Department of Public Health that we should expect possibly this week to hear an announcement that the state will be making some changes to the blueprint, and that what I recall is that one of the things that they're looking into would be possibly changing the threshold that must be met to move between red and purple tier. And that, so there can be changes there, but also not just to change the threshold, triggers that would have to be met in order to implement those changes to the blueprint. So we hopefully this week we'll get information on that from the state. In terms of testing, our testing rates continue to decline here in Monterey County and across the state. But we still have a lot of testing capacity. We still have our 4 Optum Serve sites that the state has placed here in Monterey County, and our hospitals and some of our providers are still available to test and are still, when appropriate, are recommending testing to their patients. So I encourage residents to get tested either at an Optum Serve site or at one of the providers, particularly if they have symptoms of COVID-19 or they're exposed to someone with symptoms of COVID-19 or someone who's confirmed COVID-19, and also wherever state guidance recommends that individuals get tested, for example, certain work settings or school settings. So still have a lot of capacity to test, and I hope we can use that capacity. In terms of the vaccines, most people are aware that there's another vaccine, a third vaccine that's been has received emergency use authorization. And that vaccine, based on clinical trials, is 67% efficacious at preventing COVID-19, specifically moderate and severe illness. And it can also reduce the risk of hospitalization for those that do get COVID-19. It is a one-dose vaccination, one-dose vaccine, and the state has shared with us that there's an anticipated 20 million doses committed by the manufacturer to be delivered to the United States through the end of March. We were also told that we could expect up to 300,000 doses to be allocated to California over the next 3 weeks, but we don't have any details as to how much Monterey County will receive through state allocations. And we were just notified, or I just found out today on a state call that there are some federal partnership pharmacies that will be getting some of this vaccine. Those are the pharmacies that have been recently receiving federal allocations of vaccine. Those are vaccine allocations that don't go through the state of California. Right now, the pharmacies that are involved with that partnership include Rite Aid, CVS, and Walgreens, but we don't have no details were provided on the allocations to the federal partnership pharmacies. As far as the state vaccination plan, as Maya mentioned, more people are eligible to receive the vaccine. So we are now in Monterey County making efforts to vaccinate anyone who's 65 and older, and also anyone who's at risk of being exposed to COVID-19 who continue to work as healthcare workers in the food, in agriculture, in childcare, and education, and emergency services. And the details of which particular groups or individuals or jobs in each of those sectors that are eligible for vaccine can be found on the state's website. In terms of, let's see, we have, I just checked, and we have updated our county website to reflect the newly eligible groups. People can also go to our website for updated information. There is one particular group that was highlighted by the governor, and that is the group of educators. And the governor had expressed his desire to have 10% of our current allocation be dedicated to educators. So there's no new vaccine with that. It's just for us to take 10% of what we were allocated and try to get that directed towards educators. So as Superintendent Gus mentioned, she and her team are working with the superintendents to arrange for closed pods, points of distribution, PODs, with vaccine providers to get vaccine directed to educators and some childcare providers as well. As far as vaccination data on our website, we continue to post the information, including the percent of vaccine in Monterey County that has been administered. That's currently, 77%. And the proportion of county residents 18 and older that have received at least one dose of of a vaccine, and that is 15%. So 15% of Monterey County residents that are 18 and older have received at least one dose. These are, of course, estimates, and we will continue to, our team will continue to work here locally and also work with the state to improve reporting mechanisms statewide that we can continue to share with the public. We also have information on vaccine provider data. So we have the list of, I think it's 24 providers now, or provider locations that are vaccinating, and the doses they've received and the doses that they've administered, either as reported through the state registry, which continues to have limitations in its ability to report accurately, but also doses administered according to the provider who gives us information weekly as to how much how many doses they've administered. We also have data on our residents that have been vaccinated by age and race ethnicity, also by geographic region of residence, and also by soon we're going to be posting information on residents who have been vaccinated by zip codes in which they live. We hope to have that up hopefully by Monday, and we will be updating that on Mondays, and that is to align with the information on the weekly shipments of vaccine coming into Monterey County. And then finally, I'll just end with what was shared with us, and that is California. We were told that California should expect to get 3 million doses administered in the month of March and 4 million doses in the month of April. I don't have any more details on that as to which vaccines comprise those allocations to California, but we're continuing to receive weekly vaccine, and we can anticipate being able to hopefully have a ongoing stream of vaccine coming to Monterey County, and hopefully, especially with this the new vaccine that's been received an authorization, begin to see increased allocations coming into Monterey County. And I'll end there. Thank you.
Thank you, Dr. Moreno. And then we'll go ahead and start with the questions that we have. I did have a question come in before the briefing by text, and I'm going to go ahead and take care of that one, and then we'll go to the questions that were in chat. And this is for you, Dr. Moreno. At the end of last week, the state announced that MyTurn, California statewide vaccine network, will soon become the main source for residents to sign up for COVID-19 vaccination appointments. Could you give us some insight into how soon that would happen for Monterey County, and does that mean hospitals and clinics would all be using MyTurn?
Yes, I mean, I think the answer to the second part of the question is yes. Hospitals and clinics and Public Health Bureau will be using MyTurn, and the reason is because the state continues to stress that any vaccine provider, any current vaccine provider who wishes to continue to receive vaccine beyond the month of March must use MyTurn for the scheduling of appointments and entering data into the state system. And so we in public health really are committed to continue to vaccinate, and so we'll do what we need to do to reach an agreement with the state, including use of MyTurn if that's absolutely required. We'll do that in order to receive additional vaccine. And there are two electronic health records that are commonly used here in Monterey County among certain healthcare providers that the state has committed to trying to create an interface for exchange of data. It's Cerner, and the other is Epic. And the state is doing this on a trial basis. They're making a very basic interface so that if the healthcare provider who's providing vaccine wishes to enter information into Epic or Cerner, there may be a mechanism that they can come up with so that information can go into MyTurn. And so those providers don't have to enter into two different data systems. And the state says they'll see how that goes. And if that goes well, they might expand that to additional electronic health records. But one way or the other, the state is saying the data has to get into MyTurn. And in order to receive vaccine, each provider has to make use of MyTurn.
Great. Thank you very much for that. And then we'll start with the questions that are in chat. I know that some of these questions have been answered in chat, but we have people on YouTube and Facebook who aren't able to see that. So I'm going to go ahead and ask the question, and then whoever answered the question can share it with everyone. And this, I believe, is for Dr. Gus. What is being done to vaccinate daycare workers who have been taking care of children in person since the spring? Many of these workers are busy taking care of children all day and do not have ample access to sign up for clinics online. Does Monterey County, or in this case, the County Office of Education, or both, plan to host mobile clinics at daycare sites? And if so, when?
So that's a great question. We actually have already scheduled several clinics for early childhood educators. And, just looking at the list really quickly, I want to say between the existing clinics, we have about 500 early care educators who have already either been vaccinated or they have a scheduled date to be vaccinated. And those clinics will continue. So, and I don't think I answered the whole question. Can you repeat the question one more time?
Sure.
What is the county office doing to help? Great
Yes.
question. Yes. So we actually have a team. It's the Child Care Planning Council working with QRIS, Bright Beginnings, and First Five. They are creating a list of every early childhood educator in our county. They're collecting their contact information so that the moment clinic appointments come up, we can reach out to those individuals and help them get registered for those clinics. And we do have staff that's bilingual, biliterate, so they are able to help all of these early care providers get their appointments scheduled.
Thank you very much. And then the next question could be for you, Dr. Gus, as well as Dr. Moreno. Where can teachers register to get vaccinated? Should they go through hospitals, the county website, or should they check with the Office of Education for closed pods?
So the way teachers can be or can sign up for their vaccination is either through their primary care provider. They can also sign up to be vaccinated through one of the local pharmacies offering vaccines. We also have employers who are providing or hosting closed pods. We have the health department that's offering closed pods. So there's lots of different avenues for educators to sign up to be vaccinated. They should take the first available appointment. So if their primary care provider already reached out to them and offered them the opportunity to schedule, they should do that. If there is a closed pod that will be available to them, their employer will be notifying them of these closed pods over the next few days. And Dr. Moreno, did you want to add to that?
Yeah, thanks, Deneen. Yeah, I just want to add that the Monterey County Public Health is also still offering open pods, which aren't restricted to any particular sector. It's just if you're eligible, you can get an appointment. And our hospitals are also still offering open pods. So if you're 65 and older or working in one of these sectors, you can still get an appointment.
And Jason Cameron, you chimed in on chat regarding veterans who may fall into the educator or child care grouping. They can follow through your description of getting their vaccine through the VA, correct?
That's absolutely true. Yes.
All right. Thank you all very much for that. Going on to our next question. This is for Dr. Moreno. Who is responsible for if there is inequitable distribution and administration of COVID-19 vaccine in Monterey County?
So I think all of us who are engaged in making vaccine available to Monterey County residents, I think we're all responsible for trying to do what we can to promote equity in the distribution of vaccine. My role, I have a dual role. I have the role as the party responsible for submitting orders to the state of California to ask the state to approve orders and make those distributions available to our vaccine providers. And in that role, I look at the data that I've been sharing publicly, the data that we have on our website, to look at those either geographically or by race ethnicity, those populations or communities that are not receiving, do not appear to be receiving their share of the vaccine. And given that information, I look at the vaccine providers that we have serving those communities and making sure that we continue to make approved orders for those vaccinators and calling them on a weekly basis before we submit the final order to make sure that they can, if given the vaccine, that they can certainly vaccinate people in those respective communities. So that's one of my roles. And then my other role is as a vaccine provider. So Public Health Bureau is one of 24 locations or entities that are vaccinating. And so we want to make sure that we do what we can to make sure that we make vaccine available as well. Currently, we have just recently we did restrict or added, we added 65 and older who are from certain zip codes. And that was an attempt to try to bring people into open pods that meet those criteria to try to increase accessibility to those particular zip codes. And our vaccine providers, given vaccine, particularly in Salinas and South County, are doing what they can to make sure that when people are signing up for vaccine, as much as possible, those individuals do represent the communities that have until now still not received an adequate share of vaccines. So again, I think a lot of individuals involved with vaccine distribution, vaccine and vaccine administration have a role in all of us trying to work toward the most equitable distribution of vaccine possible.
Thank you, Dr. Moreno. And here's another question for you. And I think this is in regards to the change in the blueprint that you had mentioned earlier in your presentation. A report came out today that Governor Newsom is considering moving the entire state into the red tier in the near future. What do you know about that possibility, and have the counties been notified of that?
Don't have any information other than what was shared with us about the possibility that the state will change the thresholds or criteria that must be met to move between the purple and the red tier. For us, we're in the purple tier, so that would we'd be most interested in changes that would move us into the red tier, and that's all information I have.
Certainly. And then there's a question about whether we've been able to receive any of the Johnson & Johnson vaccine. And I think you covered in your presentation that you aren't sure when we're going to receive this vaccine, correct?
Correct. We haven't received any information about the number of vaccines from that manufacturer that will be coming to Monterey County, either through the federal allocation or the state allocation.
And then another question for you. Has the county started to receive a much larger portion of vaccine or much larger allocation?
We have, so over the last 2 weeks, we received approximately 10,000 doses from the state allocation. And that exceeds the previous weekly allocations of about 6,000 doses a week. So we have had an increase, definitely, certainly an increase in the state allocation that we then place orders to the state to deliver vaccine to our vaccine providers. In addition to that, Clinic of the Salud has received, I think, up to 5,000 doses in their first allocation as part of the federal partnership with federally qualified health centers. So that adds another 5,000 doses in addition to the 10,000 doses per week we received in the last 2 weeks. So we definitely have seen an increase in doses. And in addition to that, there are additional pharmacies that are now receiving federal allocations. And hopefully soon, we've been told that the county's federally qualified health center, the county clinics, are on the list to begin to receive their share of federal allocation, of vaccine, hopefully in the near future.
Thank you. And then a question for Dr. Gus, and this looks to be our last question in chat. We are hearing from some districts that they are not returning at the new April 1st date requested by the state, and thus losing out on some funds. What is the logistical challenge for your schools and districts to adapt to this new deadline? And how much of a factor is changing plans with 1 month's notice playing in not returning on April 1st? And then April 1st is also spring break, so would that impact funding? And if you want me to chunk this question out again, I'll be happy to do that.
Well, let me tackle it and see if I can give you a comprehensive answer here. First of all, it's a very complicated process. And so I just want to ensure that everyone understands that in order for a school to reopen, first of all, it has to be allowed under the CDPH guidance. And as you know, right now we are in purple. In purple, only TK to grade 6 students are able to be in person at this time, and small learning cohorts. If we move to the red tier, as we were talking about a little bit earlier, then middle schools and high schools would have the opportunity to open as well. So it's important to remember that every single school district is in a different situation with their reopening process, in that each school has to work with their community partners and their union partners and their school board to develop a CSP, their COVID safety plan, and they also have to have a CPP, their COVID prevention program. Those plans have to be adopted. They have to be approved and in place for a school to be prepared and ready to open. Now, with that said, we also have 24 different school districts. We have 10 charter schools and 22 private schools in our county. And the public schools alone have 24 different school calendars. So their spring break falls at different times depending upon their negotiated, what their negotiated calendar already has in place. So the question around opening by April 1st, I just want to be very clear that this is a Senate Bill 86, AB 86. This is the deal that the legislature and the governor have been working on for quite some time now, trying to set aside funding to help support schools to be to reopen as soon as possible. The schools that were already open, these new funds and these new rules will not impact those schools at all. These funds are only set aside to try to help school districts reopen as safely and as quickly as possible. And so the goal is to try to get opened by April 1st, but they're not required to be opened by April 1st. They should be opening when they have their CSP, their CPP in place and ready to go. And again, they have to work around their own district's negotiated calendars to plan their reopening dates. So I hope I answered that question. If I missed a piece, let me know.
I'm looking, just kind of reviewing this question. I think maybe, did we address the funding part? I think there's some anxiousness about, you know, the carrot that's out there with that funding could be a driver that maybe some schools just simply cannot, you know, they may be trying hard, but they may not be able to reach.
Right. So let me give you a little bit more detail on that piece. In order to be eligible to expend funds, a school district must provide in-person instruction by April 1st with the ability to gain partial funding on a sliding scale if opened by May 15th. Between April 1st and May 15th, an LEA's funding will be reduced by 1% for each day of instruction the LEA or the school district did not provide in-person instruction. Remember, this is extra funding. So it's not, a school district will not lose their regular funding if they are not open by April 1st. It's just in order to gain some additional funding, they need to open as soon as they possibly can within that window.
Thank you. I think that does address the funding in its entirety. And then I did have one question come in, and whoever, if you are not speaking, if you could mute yourself, I don't know who's got some ambient noise here, but if you could mute yourself, that would be great. Are schools getting Dr. Gus, are schools getting funding to offer athletes weekly testing related to sports?
They are not getting funding that's directly for that purpose only. But again, if they do apply for this funding that we were just talking about, and again, I do want to point out that right now this is a proposal. This is supposed to be, or we're expecting it to be approved tomorrow by the legislature, and we're hoping that it will be signed by the governor on Friday. So that's important to remember. School districts, though, can use their CARES funding, they can use their LCFF funding, and if they receive these additional funds, they could also use this funding to help support the cost of the weekly testing.
Okay, thank you. And that's all the questions that I have in chat right now. If anyone has any other questions for our presenters, I'll give it another couple of seconds here, and I'm not seeing any. So that will wrap up our briefing for today. Thanks very much for joining us. Our next briefing will be next week, and we'll see you then.